Alright, so what I'd like to show today is some techniques for rolling out your IT band. The IT band runs from the side of your knee here all the way up the side of your leg and up to your hip. A lot of people, when they're rolling out their IT band, they tend to just focus on the side of their leg, and they don't spend enough time rolling forward onto their quad or back onto their hamstring, or treating some of the hip muscles that also have attachments into the IT band. So what I'd like to show today is techniques for treating all of those areas to make sure that you get your best likely outcome from doing foam roller treatment yourself at home. So we're going to start out using this foam roller. Any foam roller will do. A lot of people have the big foam ones, those are fine too. And we're going to start out with the foam roller down by your knee. Bring yourself down onto your elbow on this side. If it's too painful on the side of your leg to drop your weight right on there right away, you can put one leg out in front and sort of inch your way down slowly. But our goal for rolling out the IT band is to be able to use the foam roller to roll all the way from your knee all the way up to your hip. The more painful it is, the slower you want to roll. And at least initially, we want to stay right on the side of the leg. Once you've done 3 to 5 passes on the side of the leg, you can rotate a bit forward so you treat more of your quad. That's going to get that interface between the quadriceps and the IT band. And then you can do a similar thing by rotating backwards and treating some of the hamstring where that attaches to the IT band. As well as simply rolling from end to end, you can also introduce some movement at the knee to further loosen up that IT band. So if you found a spot on the side of your leg that's particularly tender and doesn't seem like it's letting go with rolling, you can stop on that spot, wait, and then bend your knee, flex it all the way up, and then all the way back down. Move maybe an inch or so up. Same thing, flex and extend. Along with treating the side of the leg with the foam roller, you can also use this other product. It's called the quad baller. It's a bit more focused pressure, and so it's going to be a bit more effective at treating your IT band symptoms. However, for a lot of people, it's going to be too tender initially, so it may not be your first best product, but it's worth a try if you've had IT band symptoms that have been lingering, or you're no longer getting the treatment pressure you need out of the foam roller. So it's the same sort of principles with this. Stack your legs up, roll all the way from your knee up to your hip, straight down the side, more towards the front, more towards the back, and so on. So the other two areas that we want to treat with both of these rollers in order to effectively treat IT band problems are up in front here, which is the TFL muscle, kind of front pants pocket region, and then the hip muscles, which are the back pants pocket. So we'll start with the back of the hip. Start with the same foam roller. We're going to sit right on the roller with your knees bent, feet are railroad track together, knees are leaned down about 45 degrees, and you're going to roll from your sit bone all the way up to belt line. If you feel like you're sliding off the roller as you get higher up towards your belt, you can bend your elbow and drop down a bit, and then back up in through here. The next spot to treat is the side of the hip. We didn't go quite that far up previously when we were rolling out the side of the leg, so it's a very short span in between your front pants pocket and belt line on the side. So we're going to roll through there, short rolls, and then rotate forward again, and we're going for that front pants pocket area. One more spot there. So to recap, most people are typically treating their IT band only by rolling the side of the leg, and you want to hit all these different muscle groups in each of these ways in order to really relieve the symptoms, as well as potentially treating other leg muscles as well to